Some people with cerebral vascular occlusion will suffer from cerebral infarction, which means hemiplegia, inability to speak, or even coma. For some people, if the occlusion is gradual or even sudden, it will not cause serious consequences. That is, the brain can compensate well. For example, if the carotid artery on this side is occluded, there may not be any symptoms. Why? It will cross the vascular ring at the base of the skull from this side. Or is it from the vascular ring at the back of the skull base, or the surface blood vessels? The blood supply to the opposite side is sufficient, but it changes the direction of blood flow. For example, if the blood vessels on this side are blocked, the blood flow from the opposite side will provide more blood flow through some small branches. Or the communication branches are provided with countermeasures so that the original blood vessels will bear greater pressure. Generally speaking, it is more likely to have an aneurysm or a rupture of an aneurysm. Of course, if a blocked blood vessel is blocked and there is no aneurysm in the brain, will it increase the risk of bleeding? The proportion of increased risk of bleeding, in theory, will be higher than that of normal people, but it is increased, or the risk of this happening is very low, very low. So it really depends on the specific situation. If an aneurysm develops due to vascular occlusion, for example, if it wasn't there before and now it appears, or if an existing aneurysm changes, then some important aneurysms need to be actively addressed.